In terms of this presentation, I'm going to try to keep it as high level as possible. I'll get into some of the tech stuff, mostly because I'm a geek at heart, and I assume everybody likes to know the tech stuff. So we'll get a little bit into that. But the real reason I want to talk about the tech is because I think that will help you understand better the strategies you need to formulate and consider to put in place in order to fight back from a ransomware attack. So the agenda we have for our time together this afternoon is we're going to take a little bit of a look back to some of the earlier ransomware attacks. We'll go through that rather quickly, but I think there's some key learnings there, some things that continue to happen today. And so I want to just take you through that. We're going to talk about some of the current tactics that we've seen actually being evolving over the last few weeks and that have become a key challenge for the healthcare sector. So we'll get into that. We're going to talk a little bit about HIPAA and ransomware. There continues to seem to be some confusion here about do you need to notify, don't you need to notify OCR? So we'll talk about that. The big topic ultimately we get questioned on a lot is should we or shouldn't we pay? And that's not a simple thing to answer. So we're going to spend a few minutes with there, give you some strategies that you should be thinking about and considering at the board level. And then we'll talk more about defensive strategies, and we'll do a short little kind of outtake on how we can help and some of the resources we can make available to you. Some of those are free, so I do urge you to kind of stick around for that. Again, it's not trying to sell you anything. It's just things that you can rely upon if you need them, and hopefully you will not. So with that, let's just get into it. Some of you are probably familiar with this next image or may have seen it live on television when this occurred. And this was Hollywood Presbyterian, one of the first really big attacks that we heard about several years ago. Many people think this is kind of the attack that started it all when it comes to ransomware. And I want to talk a little bit about this because there's some key learnings here and some things that we continue to see that can benefit from lessons learned on this particular attack. So just to refresh your memory, kind of here's what happened. They were attacked in a ransomware attack. And since this was so new, there was some things that occurred in the early hours. And we still see this today when we work with clients who have been a victim of ransomware. We still see this behavior. They assumed all systems are compromised. Interestingly enough, back then, that wasn't too big of an issue. You're going to see some things today where that is actually the right thing to be doing. There was reports of medical devices being impacted. Actually, I don't believe there were any at that point impacted. There was some reason early hours of this attack, people thought that there was a physical breach as well as a cyber breach, so it added to the confusion. And then they actually, I think, spent about 5 days before they ever disclosed this event. Or something like that. And I think that's not anything nefarious. It was just kind of trying to figure out what they were really dealing with and what was going on. So there was a lot of confusion, and we still see that. And even though many of you may have incident response plans related to ransomware response, we still see that the amount of confusion and the response itself are often not really in line with the actual attack, meaning people, I think, still underestimate the velocity of these attacks. So the impact, I think we kind of all know it's pretty similar to us at this point in the industry. Unfortunately, there was a massive disruption to the hospital. In this case, it wasn't too bad. It was about 7 days. And by that, it doesn't mean that they started taking patients back. If you remember, when this attack occurred, they actually diverted patients and they transferred patients out of their hospital to other hospitals. So they kind of got themselves under control within about 7 days. There was major system impact. The McKesson system that they ran got impacted. Their RIS PACS was impacted. There was impact to operational systems. By that, we mean that the ransomware took over those systems. It was kind of house-wide in terms of what it impacted. They went to paper. And then the IT recommendation was just to bring everything down. Again, they didn't really know where the system, what was actually infected or not infected. And again, we'll talk a little bit about that. But the impact was pretty serious. The sad news is that today, years later, when we see a ransomware attack hit, we still see the same response. We still see the same confusion. We still see the same level of disruption. And it's an important thing to know when we get into the pay, don't pay conversation. This is something that's really important to get your board and execs to understand. And I'll explain a little more about that when we get to that section of the presentation. So how did this happen? At this point, looking back on this, and again, so many years ago, we still see, though, the same breach vector, which was email. Now, the interesting thing is a lot of times I'll talk to different organizations And we all know it's email. They'll all say it's phishing. And when I ask them, like, well, have you ever actually seen the ransomware attack occur? Do you know what it looks like and what actually happens to the files? Now, everybody's like, well, they get encrypted. But the user experience, I think, is important to understand, because when we talk about security awareness training and educating our users on not clicking on things, I think all too often we fall or we fail to really clearly give them concrete examples of what it looks like to see a ransomware attack and what they're going to see. So this attack occurred through email. This is not one that went to Hollywood Presbyterian, but it is an actual infected email that contains the same ransomware attack that was used against Hollywood. So it's a legit Outlook email, and legit, I mean, it's actually infected. You'll see here that this invoice is attached. Again, to this day, we see people getting invoices that they open, and we deal with these attacks often where we'll hear that, oh yeah, our HR person, our finance person, they're the ones that opened this invoice and it was from a partner or somebody they know and they were attacked. I will tell you, if you're going to invest in security awareness training, honestly, it's some of the biggest areas to invest in and really hammer home the message of being ultra careful is your executives, your finance department, your HR. If you have payroll, purchasing, procurement, it's kind of the operational side of your house is really the ones that are the most exposed, because this invoice trick works really well. We have gotten to the point now at our company where we don't accept resumes as attachments. We ask people, whether it's PDF or not, that they have to actually copy and paste the body of the message into the email itself so that we're not opening attachments, because HR is a huge vector for these kind of attacks. So once they click, what do they see? Well, I'm going to kind of jump forward. They are asked if they should open the file, and this is just a Word document. Now, here's where part of the education on the user is really important, and something for you to understand is that this is right before this ransomware attack is going to hit, right? What we're looking at right now is a blank Word document, and 99% of users will just go, I don't know what the heck this is, close it and move on with life. Some percentage of them will click that little enable editing thing. And the issue there is that as soon as they do that, the ransom is going to execute. The actual ransomware or any virus or whatever may be there is going to execute. And teaching people this, that if they see this screen, a blank screen, or they get an error, something asks them and it says, oh, I'm sorry, this file doesn't have an association, or they get any kind of error, they made the mistake of opening the attachment or clicking a link. One of the big things that we, as an industry, need to get good at is telling our end users that they should report that, right? If they actually do mistakenly open something up or they mistakenly click a link, we need to take the training of the end user to the level where they know it's okay to report that. Because right now we've seen too many situations where the user's been scared to report it, doesn't know they should have reported it because nothing bad happened. No skull and crossbones appeared on their screen at this point. The issue is that their payload could have been executed. So I think a takeaway for you today is really you kind of have to get real deep in terms of what you're telling users when it comes to that phishing education. Not just how to spot a bad URL or bad grammar in a message or think before you click, but hey, if you do click, here's what's going to happen. And if you do, call the help desk. Let us know so we can take a forensic view of this PC or this laptop and figure out what's happened. In this situation, the user would have seen that something bad happened, right? Because this is the kind of default message that comes up when somebody clicks on a ransom message and is actually told, hey, guess what? Your files are being encrypted. Now, when we talk about incident response, we're very tactical in our incident response approach, and when we work with clients, one of the things we would suggest to you is consider immediate action drills. And this is really the focus of the help desk. The help desk is probably going to get the call in most cases. You may say, no, our users will call the security incident response line if you have one, or a CERT team, or IT security. Chances are they're going to look at this and it's going to be gobbledygook. There's a bunch of numbers and letters and Tor and RSA 248, and they're not going to be able to do anything, so they're going to call the help desk. You've got a couple minutes from the time that this occurs to the time that help desk picks up the phone to analyze this situation and shut down the power, disconnect from the network. Now, usually I get a question like, well, don't we want to preserve the evidence? You have a choice. You could preserve evidence, or you can stop the spread of the attack. We always err on contain the attack, minimize damage. The reality of life is, if you get evidence, I don't know what you're going to do with it, right? You can analyze it. And there's a lot of consulting firms, including ours, that would be happy to come out and analyze it for you. You may have your own forensics team, but frankly, it's not like the FBI is going to run out and arrest anybody. So contain the attack. And that's really the immediate action drill. When we talk about tactical incident response, it's getting that help desk to know what this looks like and then know what protocol to put in place. And you've got a few minutes, and I'll explain why you've got a few minutes to respond to this and kind of stop it. But only if your user and the help desk both know that A, if you do something, call us, even if you don't see anything, and B, the help desk knows how to analyze and triage that situation. Do not make the mistake of telling your help desk to then call the IT security team until they've dealt with this situation. Because if they have to track down somebody on IT security, then IT security calls back the end user and they triage this situation, probably it's game over. So the help desk has to be empowered and has to understand at this point in our history and our evolution of cybersecurity, the help desk has to really understand how to deal with a cybersecurity attack. And that's a real important place, if you guys are thinking of where to invest money, is training that help desk to do that. So this is what it looks like if you were to open up the File Explorer, and basically all the files get renamed. You can see this is the Locky ransomware. If you open one of these, it's gobbledygook. So yep, it's been encrypted, but just wanted to at least show you what it looks like. Some of you may have seen this. Some of you are like, I've actually never seen what this encrypted stuff looks like. You can try and rename it if you want. It's not going to do anything. Fact is, the data is scrambled. And depending on what it is, your backups are gone and it's made its way through your organization. So that's kind of the pattern that we see typically on any ransomware. And so I kind of want to talk a little bit about, in this case, they paid. There was a decryption page. You can see it's a pretty nice looking web page, and there's a code to decrypt after payment. But I want to talk a little bit about some of the other stuff that goes along with this, and that's the payout. And so when this occurred, Hollywood Presbyterian paid out $17,000 to get back the decryption key and decrypt the ransomware. That was about 40 Bitcoin, and Bitcoin is the currency that we see most ransomware demanding. Now, the interesting part here is that economics and the growth of our economy has all played into this, and it's kind of a good living for ransomware attackers. So I don't know what it is today in terms of what 40 Bitcoin is worth. I do know Sunday, when I was working on this presentation, it was $400,000. So if you're hit by a ransomware attack today and you have to pay out 40 Bitcoin, you're basically writing a check for 400 grand. Now, I will tell you that this is a pretty good slide, and you guys can have the slides. If you reach out to us later, we're happy to share this with you to kind of sit with your board and get them to understand not only the disruption to the hospital, but the conversation around pay or don't pay really is, are we willing to pay 400 grand or not? Now, we'll talk more about that strategy in a little bit, but I just kind of want to put things, even though this was Hollywood Presbyterian, what that means in today's dollars. And this doesn't include the loss of revenue, the recovery efforts, and all the other things that go into trying to come back from a ransomware attack. Now, some of you may say, well, we've got cyber liability insurance. I can tell you that cyber liability companies are taking a much tougher stand on paying things out. On the early days of this, they were paying out. It was easier to pay out. I mean, it was 17 grand, you pay it out. Now it's $400,000, $200,000. We just saw one for $326,000. And insurance companies are now sending out insurance adjusters, and they're going through your policies and your practices and your procedures and then determining the payout. So it's kind of like OCR visiting you, except it's your insurance company. And so you need to really think about, is cyber liability insurance going to do this and pay for it? You need to have conversations with the insurer or your COO or whoever's CFO, risk manager, whoever's doing that side of the equation should be asking, are there limits on the payout? What are the circumstances? Are they going to send an adjuster? What happens if you're not fully following best practices? What is the impact to you on the payout? So you're not surprised. It's a kind of a lot of maturity in the conversations that have to occur now when we think about ransomware and payouts. So I'm not going to spend too much time on this because I got a bunch of stuff, but there is an evolution to ransomware. There are basically two types that we see, encrypting and non-encrypting. Pretty straightforward. Encrypting encrypts files. First version of that we saw was back in 1989. somebody got kind of upset and put out this ransomware, this encrypting file to kind of get back at some people. It was dubbed the AIDS Trojan. Non-encrypting is still ransomware, but it doesn't encrypt anything. It just holds you hostage, right? Basically, it'll say, you know, we're going to keep sending images of pornography to your screen until you pay us this amount of money or something else, right? Pornography is typically the one that is used, and basically they take over your session and they just continue sending images. They're now employing worms where these images start moving across your environment, and now you have pornography showing up on all the screens basically across your hospital. The response is kind of the same. Your help desk needs to be able to react quickly and shut this down before, right, get in that containment model, tactical response model, shut this down before it spreads. So those are kind of the two real kind of approaches to ransomware we've seen. The one thing on encrypting is it does take time, right? One of the things we're all concerned about as technologists is when we use encryption, there's always this overhead, right, that we have to encrypt or decrypt, and that causes some kind of overhead. So when you think about ransomware running amok on your network and encrypting files, it's going to take time, right? It's not going to just in like 2 seconds, you know, encrypt the entire organization. Now it's going to move pretty quickly, but you do have the ability to respond to it if you've thought it out. And by thought it out is you have to be focused on tactical incident response, not chain of command, not looking for authority, but really trying to contain the attack as early and as quickly as possible. And a lot of times that just means pulling the plug. And there's some things to consider, right? If you shut down a laptop, the battery may continue. So you have to educate the users on how to properly shut down whatever device they're talking about. Obviously, this is when we talk medical devices, the response has to be slightly different. And we have a whole protocol around clinical rapid response for devices that I'm not going to go into here, but just keep in mind, I'm talking about non-patient facing equipment when we're talking about powering it down. But something to think about. The non-encrypting, same kind of protocol, shut it down like we said. You probably have less time because we're not encrypting files, we're just streaming things to different machines, so that's going to move much, much faster than that. One thing I will talk about here is we have seen the use of timers increase in ransomware. What that means is whether it's encrypting or non-encrypting ransomware, we have seen the attackers start to say, you know, we want 40 Bitcoin in the next 72 hours. For every X amount of hours that we go beyond 72 hours, we're going to double or triple the ransom. So it's kind of forcing people to quickly make a decision. And this is something else you need to think about with your executive team, that the incident response here needs to involve them. If you get into a situation where your hospital is put into a ransomware situation, you may have a clock ticking that you need to keep in mind. So this is, you know, these are real hostage situations. We have heard of, you know, sometimes people say, well, you know, what if you don't pay? And we have heard of one incident of retaliation for non-payment. Now, what I mean by that is the attackers actually didn't just not decrypt the files, they actually started destroying stuff. So you do have to think more about, hey, if this person is willing to lock down a hospital with ransomware, am I really wanting to take a chance on not paying them? On the other hand, maybe you don't want to pay them. And so if not, you need to think about that. I guess the easiest way for me to explain this is respect the audacity of the attacker. Now, again, we've only seen this one time in, you know, so many years, but it's something in the back of your mind that you need to think about if you decide not to pay. We do see ransomware spreading to IoT devices and smartphones. Typically the smartphone stuff, you can replace the smart easily. The IoT devices, that's where we start seeing things affecting access control systems, CCTV, HVAC, oxygen distribution systems. You know, it may not be as as in your face as locking up your desktops and servers, but if somebody locks up your HVAC system and the hospital doesn't have air or airflow, you may have a different, more critical situation in your hands. So just know that it is spreading beyond just the traditional desktop and server environment. And we have seen, although in the Hollywood Presbyterian issue, I don't think we saw any medical devices since then, we have seen medical devices compromised. I want to clarify that though, because in the situations that at least I know of, that medical devices have become compromised by ransomware, It has not been a direct attack against the medical device, meaning an attacker has gone out and said, I'm going to go take down these medical devices. What has happened is the medical devices were on the same network as the rest of the infrastructure, and they just kind of were collateral damage, if you will. It wasn't a targeted attack. It was basically they just happened to be in the way, running similar operating systems as what the attackers were going after, and the medical devices got locked up as well. So, I want to kind of now take us to 2016 and this SamSam ransomware. This is a little bit different than Locky. The reason I use SamSam is it's an easy kind of ransomware to understand. The first one I just showed you with Hollywood Presbyterian, we talked about a little bit, was really kind of propagated through email. And one of the issues that I typically have when I'm working with organizations is most people will tell me that, well, yeah, ransomware comes from email. Just got to be careful not to click on anything and you're safe. So if that's your thinking, we can revisit that after SamSam, and I take you through that. And I use this because SamSam has targeted healthcare. I believe this is what happened with MedStar. I could be wrong on that, but I think this is what affected them. So it doesn't target humans. SamSam, if an attacker is using SamSam, it's not going to come at you from an email. It's not going to come after humans. They go after servers. And so the issue here is unpatched servers. And so if your patch levels aren't up, then chances are SamSam is going to have a field day with you because it's going after your most critical infrastructure. Now, the cool part about SamSam, if you will, is that it includes negotiation. You can get bulk pricing, and I'll show you that in a moment. But let's just talk a little more about SamSam, how it works. So what it does, it actually, and this has been updated. This is back in 2016. I'm going to show you the new variants of what this does today. But back in 2016, this thing was looking for JBoss servers. One thing that's interesting is a lot of organizations don't know what the bill of materials are for the products that they're deploying. So you may have JBoss in your environment and not be aware of it. You may have bought something from a network provider, server infrastructure, switches, routers, WAPs, and they may have JBoss running in them. The thing important though here is just because the SamSam's going after JBoss doesn't mean it can't go after other things, but this is how it kind of works. It finds a vulnerable server, it deploys the server. Once it deploys onto the server, it begins scanning the environment. And then it starts figuring out how to catalog those servers. Once that happens, it just starts encrypting your environment. Now, the fact that this has no human interaction, this is a very dangerous situation because typically when the human sees that kind of nasty message on their screen, they call the help desk or they call somebody and you know you've been attacked. This guy stays silent until it's finished. And unless you get reports of slowdowns or abhorrent behavior in your environment, or you have a security operations center monitoring what's going on, if you don't have continuous monitoring, your chances are that this will spread. And by the time you know that it's happened, it will be too late. Things will be just too far gone. Once it's done, it self-destructs, meaning the actual distribution mechanism and all the way that it does its code, it just deletes all its evidence. And the only thing you're left with is the encrypted files and then this nice little message that tells you that, hey, hey, here I am and I've encrypted everything and you owe me money. So how hard is it to find JBoss files? And so this presentation I did a while ago, and I literally like 3 years ago, and this little snippet of code you see on the screen right now, this is kind of an easy search for finding all JBoss servers that are exposed to the internet. And it doesn't mean that it's on your public facing. It may be exposed because of a support agreement you have in place, remote support, things of that nature. And on the right here is basically the results of that. Now, like I said, I'm going to stop sharing my screen for just a moment. So I'm going to hopefully be able to show you this. So I'm going to switch over to Google, and just to see what happens, I'm going to paste that code into here, and I'm going to run it. And what you'll see is even today, there are tons of JBoss servers out there that are not patched. This actual little snippet of code that I have here, this little search, what we call a dwark, actually goes out and finds all vulnerable servers. And I can click on this and I can get the server info. I don't know if this will come up. That one's not coming up. It's not being responsive. All right, so here's one that's the JBoss servers up, right? And I could see kind of what's going on in the environment and the level of patching and what's happening. The reason I'm showing you this is just to kind of let you know kind of what the tactics are that attackers are using when they go out. And that to this day, the SamSam was a thing 2016, and we still have servers out there. Now, if you modify this, if I put site equals Sunrise Medical Center, which I think is a made-up hospital, I hope it is, then it'll find if Sunrise Medical Center has any vulnerabilities public facing, right? And I can change JBoss to whatever I want, and this snippet will work. So when you guys get the slides, you can play with this. Just add site colon and your IP address or your .com, and it'll find anything with JBoss. If you change JBoss to like ASPX or something else, you'll find other things that are out there that may be leaking from your environment. So once we get a list of the host. We go ahead and execute lateral movement. We have this little executable we run, and we begin mapping the network. And this little for loop here just maps our network and our drives. That's how we find out how to go through and actually grab the different files. We then go ahead and generate the public and private keys. This is what this does here. This is pretty straightforward code. We then look for locked files and backup files. We kill any lock file, meaning we issue a system command to kill anything that's in memory that we can't encrypt. And this is where you'll start seeing people say, hey, my system stopped running, my server's not working, because what this is doing is actually getting into the Windows task list and shutting down services so that it can go ahead, when the service is shut down, it unlocks the file and it can be encrypted. And then obviously goes after your backups and then continues to distribute the ransomware. So that's kind of the encryption process. Because time is an issue, the way that SamSam works is that it actually looks at the size of the files, and smaller files get encrypted first, and then the bigger files get encrypted last. Now, SamSam's gotten smarter in the past few years, and it's now multi-threaded. So this actually was the way it worked in 2016. Today, it actually forks threads, and it begins to encrypt any of the larger files at the same time that it's doing the littler files. So it actually moves much faster than it was able to. All right, so down here, you can see this little thing that says, you must send us 1 Bitcoin for each affected PC to receive the private key. So this is the negotiation part, okay? So SamSam does have and give you the ability to talk to the attackers. And a lot of ransomware nowadays does do that. There's either a chat window or an email address or something you can use to talk to the attackers. So let's step back for a minute and think about incident response. Part of your tactical incident response should be who in your organization is going to be responsible for negotiations, right? You probably don't want somebody who's really, really angry upsetting the attackers, right? So you need to figure out, like, who is this? Is this OEM? Is this public relations? Is it IT security? Like, who is going to talk to the attackers? And it's kind of weird because a lot of us don't think about that, right? Like we're IT centric with incident response, and yet this company, and we got to figure out who it is that's going to speak to them. So I'll give you some techniques and some things you can use if you want to negotiate with them. Some people will say to me, well, we're just going to have law enforcement do it. That's all well and good, but you probably got to wait for law enforcement to get there, which is fine, but your hospital's at a standstill, you're on paper. By the time law enforcement gets there, figure out what's going on, they're going to have to figure out who negotiates. So it's not going to be like a, hey, 3-4 minute thing. So think about that as part of your incident response. So in this case, SamSam's saying, hey, 1 Bitcoin for every machine that's affected. And so again, I just did a little bit of simple look, and I said, well, if there's 500 machines that got affected in your hospital, you would be looking at a payout of $4.9 million at today's Bitcoin value. That's 1 Bitcoin per machine, right? 500 machines get affected, it's 4.9 million. So hopefully you're going to be interested in negotiating, because I don't know many hospitals that can write that check, and I don't know many cyber liability insurance policies that are just going to blindly go, yep, here you go, you know, for $4.9 million check for you. What happens? So here's kind of the window that actually is used. This is SamSam's negotiation console. So you can see people have put money and time into this and know what they're doing. A few things you can do, a few strategies that you can think of employing when you get into the negotiation phase. One is you can call us, and I'll explain that in a moment. I'm not saying that from a sales perspective. I'll talk about why later on, but that is something you can call and say, hey, have you got any advice on this? But the advice we would give you is kind of come across in terms of your mission, right? Remind the attackers of your mission, meaning you're a hospital, you're a nonprofit, You don't have that kind of money. You know, as much as people hear about healthcare in the United States and all the money we spend in it, you know, you don't have that kind of money. So you really need to kind of paint a picture of, you know, this is not bearable for you. They're going to hurt a lot of people. There's a lot of patients right now, a lot of mothers and children who you're not able to treat because the hospital has been attacked. And you want to do the right thing here. You know, you want to pay. You understand that you should have been more careful. They're teaching you a great lesson. Now, that may not sit too well with you, but you got to think about the objective. The objective here, if you're going to pay, is to pay as little as possible, as quickly as possible, and restore operations of the hospital. So there's a variety of different techniques, and a lot of it is just pulling on the heartstrings of the attacker. In many cases, and there's a caveat to what I'm about to say, the attackers do not know who they've attacked, right? They just kind of, especially if it's something like SamSam that has just gone out and scanned the internet and just found a bunch of vulnerabilities and then launched the vulnerabilities. They're just phishing. They're just hoping to catch someone. So if you kind of explain who you are and the issue. Now, I will tell you the caveat is two things. We have seen in the past literally 90 days, I think it was 90 days, John Walk, if you talk to him from our team, can tell you the story that I don't want to mention the name of this hospital, but we're pretty sure that they were targeted, meaning the attackers looked at this hospital, they looked at the ownership at the hospital, they reviewed, you know, annual report data, and they knew what this hospital was able to do from a payment perspective. And so when they targeted the hospital, that becomes a very difficult or different type of negotiation, because you can't just pull on their heartstrings, because they knew that this hospital was owned by a foundation, and that foundation had a good amount of money, and it was backed up by some family wealth. So it got a little bit complicated on negotiations. My point on all this is know what you're going to be able to say and not say, and don't lie, because the attackers can easily figure out if you're really truly a nonprofit or not. If you're a huge multi-hospital system, you know, worth a couple $1 billion, you're gonna have a harder time negotiating. So the most important piece here is decide what the negotiation script is going to be as part of your incident response, and who's going to carry out that negotiation before this happens, right? So this is all part of that pay, don't pay. If you're gonna pay, suspect, no matter what, negotiate. I mean, even if they ask you for 1 Bitcoin, try to get it down below that. And then secondly, what's that script? It's real important to understand what you're going to say. And if you guys have scripts and you want to run them by us, feel free to send them to us. And, you know, on an as best effort basis, we're happy to look at them and tell you we'd change it this way or that. And we're not going to charge you to do that. But so you can see here that this, I'm not going to blow into it, but basically this negotiation, they were able to lower the rate, get a better deal, and kind of move forward. So they got down to 22 Bitcoin back then. So basically they went from 1 Bitcoin from PC to a bulk discount rate of 22 Bitcoins for everything. Back in 2016, that probably wasn't a lot of money. Today, if you negotiated from 500 Bitcoin to 22 Bitcoin, you're still looking at $219,000. It's a big amount of money. So, you know, unless you're in the single Bitcoin numbers, it's still vastly. So some fun facts, if there are any, on SamSam. It is written entirely in .NET and C#. Interestingly enough, all of the code for SamSam was written using samples freely available on Microsoft's website. Now, it wasn't that Microsoft exposed anything. It was just, these are standard samples of how do you encrypt or decrypt files for good reasons. And the attackers just went and copy and pasted the sample code, added a little bit of intelligence and some network traversal code, and boom, they had SamSam. SamSam was born. Talked about it encrypting. And in 2018 alone, SamSam generated over $1 million for its attackers. So it's a rather profitable venture. All right. So let's talk and shift to the new breed of ransomware. So we've talked about SamSam, we talked about Hollywood Presbyterian. What's going on now? What are we seeing over the last 6 months, 8 months? So the issue is this little thing called, it's kind of a crazy threesome. It's this thing called MoTap, TrickBot, and Ryuk. I could be pronouncing that wrong, but I'm sorry if the attackers take offense to that. So this thing it's hit a lot of the city governments, and it has hit healthcare. And people are very scared of this. This is a quote here that you see. This particular virus actually is unlike any other virus. It has intelligence built into it, so it keeps adapting to our systems, thus evading firewalls that we have up. And that was I believe the CIO of Allentown trying to explain what was happening to his city before they paid out and tried to fix everything. And it was a pretty interesting read. But we've seen this now hitting other organizations. And again, it's kind of an interesting challenge for healthcare. And it's an interesting kind of cocktail into how this thing works. And I think it will help you kind of think about the strategies that you need to put in place. And hopefully I've given you some ideas on strategies you need to think about even before we get to this thing. So MoTap, the thing to understand is there are three distinct pieces of malware here, right? MoTap, TrickBot, and Ryuk, and they come together to, again, form this crazy cocktail. So MoTap, we're going to talk about each one individually. So MoTap started back in 2014. It was focused originally in the banking sector, and it just basically stole people's credentials, user ID and passwords. And then in version 2 came out, and that added some mail spam, which I'll talk about in a little bit, the ability to manage money transfer and doing things like banking modules. So again, it was specific to banking. But in version 3, around 2015, we saw that people were adopting it outside of the financial sector, and they added in stealth capabilities, the ability to stay stealthy while moving through a network or attacking a network, and that's been enhanced to date. And then in 2018, just last year, they added the ability for polymorphism. And one thing that it's done, which is now where this TrickBot starts happening, is MoTap, once it gets into your network, it can do a few things. It can lay dormant for a very long time. So it makes it particularly dangerous because if you could already have this in your network. One of the things we've seen is that those people who have been hit by ransomware, MoTap gets left behind. They go focus on the ransomware attack, and then months or years later, they realize, oh man, this thing not only hit us with the ransomware, it's still here. The MoTap piece of it is still here. So it could be in your environment already, is I guess what I'm saying. And so it can, and the scary part here is it can install other malware. So while it stays in your environment, it can install things as it's learning your environment. It could go, oh, you guys are running this version of Linux or these Windows machines or whatever it is. And so we're going to go ahead and now bring down malware specific to that. So that's where the whole like intelligence piece comes in. And it can detect VMs. It can detect if it's running inside of a VM. And if it is, it'll change its behavior. So even if you're doing things like VDI, there's a good chance that it's going to continue to propagate and get itself out of the VDI environment and move to another VDI terminal before you shut it down. So that's kind of a challenge for it. Polymorphism, just so you guys know what polymorphism is, or hopefully if you don't know, polymorphism is just the ability for code to change itself while it's executing. It's the easiest way to explain it. Love to talk more about it if anybody wants to, but basically, if I want to describe how to get to the number 4, I can say 1 + 3, or I can do 6 - 2. Those are 2 polymorphic means of getting to the value number 4, right? Just code can change as it moves through the world. How does Imhotep proliferate? So the easiest way is through email. And if it gets into your email, it will spread through the address book, right? It'll grab everything in the address book. And that's what mail spam is. It grabs the address book and then propagates out. The issue with that is if one of your supply chain partners gets hit with Imhotep, it will then send email on behalf of your supply chain. And this is where we see kind of those invoice attacks and those trusted supply person attacks. And this is where you really got to take time to explain to end users, hey, this is how it happens, right? So you have to be even cautious about people you know. And then obviously if it gets into your address book, it can send email from user to user. And then the other way is networking, right? Just brute forcing, kind of how SamSam did it, looks for vulnerable servers, gets into the network and behaves a lot like SamSam. Question came up in the chat window, sorry for not answering it more quickly. How can you detect Imhotep? There are indicators of compromise. If you just Google Imhotep IOC, I believe there's some stuff out there. If that doesn't work, you just email us and we can probably send you some IOC and some other ways to do it. There are some antivirus tools that will pick it up. And then there's some continuous monitoring platforms, some SOCs that can do that. But the easiest way is just look for Imhotep IOC and see if that's helpful. It's typically going to be a hash-based signature that it's being looked for. But it's polymorphic. So the challenge with detecting Imhotep is it changes itself. So even if you have a hash, it could change it. It could change its hash or change its signature, and suddenly it's not what you're seeing anymore. So a lot of it is around behavior and what you're seeing on the network wire and the packets that are occurring. So those are the two ways that it proliferates. And then so what happens here, is pretty simple. If it's doing email, it's going to phish you. It's going to lead to that document. The document's going to be open. It's going to download some kind of macro. Interesting for those of you that are kind of old like me, the macro is written in Visual Basic, which is kind of going way back. I don't think many of us have used the term Visual Basic or VBA in I don't know how long, but Imhotep even today is using VBA and Visual Basic. And so challenge is that the users typically have to enable the macros. And that's where if they think it's coming from somebody and it says enable content, enable editing, the user is helping in the proliferation of the attack. Basically, again, we're seeing this overdue account, this trusted source, you click, and kind of the rest is history. Now, interestingly, this is an actual Imhotep Word document. And it tells you the document is protected, and then you can see down here on the number 1, 2, and 3 that it's giving the users very clear instructions of how to unprotect the document. Now, you got to imagine if you're the user, and I want you to think about somebody in HR, in finance, your CFO, your COO, your head of HR. I'm picking on them because we have responded to situations when they were the ones that did this. They read this document and they go, oh, okay, hold on, let me do number 1. Let me do number 2, enable editing. Okay, let me do enable content from the yellow bar above. Oh, okay, oh, yeah. And now all of a sudden the Visual Basic for Apps thing runs. And some of you, when I was saying Visual Basic for Apps, probably said, well, we disable macro execution by default. Attackers know that. That's why they give people instructions. That's why people follow the instructions and you get hit. All right, so on the right-hand side of the screen, that's the Visual Basic code that runs for any of you that are back into the old days of Visual Basic. It's got a lot of encoded code, so I'm not gonna go all through that with you. Ultimately, this here tells it to this smqi.exe is basically going to download the malware from this retrieval, and the rest is history at that point. Imhotep's on your system. Now, Imhotep has some cool features, and they're cool because these are new features that were added. This is what we call a callback notification. I'm not going to get into the C code, but this is C++ code. And all this does is it calls a Windows API. And it tells the Windows API, hey, I want you to call me every 2 or 3 milliseconds. I want you to call me every 5 milliseconds, right? So in code or on the wire, this is what it looks like, right? So I'm creating a timer, and I'm telling that timer to call me every so often. Now, you may be wondering, why do I do that? The reason I do that is to avoid antivirus and other sweeps. One of the things attackers are doing now is they go to sleep. And so the software goes to sleep, it wakes up, it does a little bit of work and goes back to sleep. Now, your antivirus software is not continuously scanning. So what they're trying to do is basically avoid the scan. So if you think back to like, what was it, Stalag 13 and Hogan's Heroes, and the spotlights would come along. I'm pretty old, I guess, is what I'm realizing here. Hopefully you guys know what that reference is. And so when the spotlights came along, you would try to avoid the spotlight, right? Well, that's all the attackers are doing here. They've added these callback timers. But these callback timers allow Imhotep to be waken up and it can take action. So it could lay dormant for a very long period of time. You could tell the callback timer, hey, call me back in 3 days or 4 days or something like that. This is kind of also how it does the sandboxing and anti-aliasing. So even if you have sandboxes, it can persist itself. It also sets up an auto start capability where it basically says, hey, if you reboot the box, I want you to restart me as part of the task manager. So that's kind of that. So that's Imhotep. That was just the first part of this cocktail, right? We haven't even gotten to the nasty stuff yet, which is TrickBot. First seen in 2016, also focused on credentials. It does use antivirus detection capabilities as well, has in-memory, so it can stay in memory and not have to be on disk. And it can, the interesting thing here is TrickBot has the ability to attach itself to Chrome, Firefox, Microsoft Edge, and Outlook. Security patches have been set up and released for this, but it keeps evolving, so it continues to work pretty well. And if you haven't updated your security on your endpoints or your user machines, then chances are that TrickBot's going to work really, really well. One of the things it does is it steals browser history. Now, the reason it steals browser history is because it uses that browser history to construct things that your user will be familiar with. It'll send it back to a command and control center. The attackers will then take that data and construct a watering hole, send an email to your user, and suddenly you're just like, oh yeah, I'm interested in that, clicks on something, and now they can go from there. So there's a bunch of stuff they can play with on that. I'm gonna skip this for now. And so, yeah, so this is actually kind of interesting. Once TrickBot is installed and running, if you look up here, it says stop WinDefend, and then delete WinDefend. What it's doing is, if you're running Windows Defender, it will stop the service and then delete the service. So even if you have something in there that says, hey, restart it, or if it stops, reboot it, it won't be there to find. Now, your user sees this screen all the time. So even if so this is what the screen looks like when Windows Defender is active. After TrickBot runs and deletes Windows Defender, this is the screen that you see, right? And so not much difference other than turn on virus and threat protection. If you do go turn it on, you're going to get an error, and that's about it. And if the user doesn't tell you about it, you're kind of not going to know. Once it does that, it starts cataloging processes on the system. It becomes part of a task. It becomes part of the task manager and just lives in memory. So it creates its own little task. That's what's happening here. You won't see these dialogues popping up. I just wanted to show you what they look like. So you can look for TrickBot in your task manager listing. But if you have a lot of desktops, it's going to take you a while, or server. This is one of the key ways that TrickBot works. It basically just monitors the internet traffic. So you have an authentic request going in from your user. They hijack the session. They impersonate the request from that user, including the credentials. They do a replay on the server, and now they access that server, right? And they continue doing that across your environment. They just keep, and especially if you're using cloud-based systems, this becomes a really effective way to do things. That all leads us to Ryuk. Now, once TrickBot is kind of cataloged things, got users' credentials, got into your servers, and who knows what else it's done, at that point, Ryuk gets called in, right? Because remember, Imhotep can call different modules. It can bring in different pieces of software. So the problem, and so Ryuk, just so you know, just creates persistence and ends up executing the ransomware. The thing to take away from here is you have three different pieces that are all being used together, and their intelligence is that we're not seeing, like early on when we started a conversation, one of the things we talked about is trying to contain the attack, immediately contain it, right? Shut things down. Now we're seeing situations where things are much more stealthy. They're able to call themselves, they're able to put themselves to sleep, wake up, not, kind of do things a little bit at a time. So it's much harder to contain these attacks because they could be encrypting things over a very long period of time and you don't know about it. And by long, we mean maybe a 24-hour period, right? Not this like, hey, it's spreading and we see it happening and the help desk is getting 1,000 calls. So this is a new way, a new kind of TTP that we're seeing, right? Techniques, tactics, and procedures. It allows people to remain hidden for a very long time. It is very highly surgical because it is cataloging your system. So Imhotep and TrickBot know what kind of patch level you have, what systems you have in your environment. It's very, very, kind of aware, if you will. And it kind of does demonstrate that most of our thinking of ransomware is failing. Like we're so focused on the phishing side of the world that we fail to realize that we have ransomware out there that actually is really good at just exploiting vulnerabilities. And a lot of that is because I don't think we're disclosing when there is an attack what happens, right? What is actually the forensics behind that. Most organizations don't want to share that with other organizations. They just want to get past this and move on and get back to operating. What you're seeing on the screen is our kind of what we consider our rapid response protocol. I'm not going to go into all this except step number 3 at the bottom. And this is meant to be done in parallel and a whole bunch of other stuff here. It's not as simplistic as it may look. But step number 3 is what we call Restock Reset. And the reset step is this forced behavior that we try to have for our analysts and our responders, is that you need to think about it wasn't just this attack. Was this a smoke screen? The reason I bring this up is what I said earlier. There are attacks we're seeing that are smoke screens, that just leave things behind. An attacker will attack, let's say they do a ransomware attack on 4 or 5 laptops and you guys shut it down. Oh, wow, we responded to that, we shut down that ransomware attack. Well, that wasn't the real attack. The real attack was to get Imhotep in your environment and take your eye off the ball and have you go after some low-hanging fruit. So this reset should be part of your incident response plans, right, or culture, whatever you're doing. Again, this is kind of a tactical incident response. So just like in a military or law enforcement, after you have an engagement, you reset, you look around, you make sure there's nobody else attacking you. That needs to become part of your incident response capability as you think about what you're doing because of these new ransomware attacks and what we're seeing. So talk a little bit about HIPAA. I'm going to move things along a little quicker. I want to be respectful of your time. Here's the thing with HIPAA and ransomware. We get the question a lot, well, do we have to disclose? Don't we have to disclose? The reality is that if you look at the definition of a security incident, ultimately HIPAA says, yes, a ransomware attack is a security incident. And so the fact that, and the way they look at it is if you've lost access to the patient data. And since you've lost access to the patient data, even though it's still on your systems, you no longer have the ability to access it. That is considered a security incident. Obviously, this is a debate and a conversation for the legal folks in your organization. So I am not a lawyer. I'm not trying to give you legal advice. I'm just trying to point you in the right direction. You need to look at the security incident at 45 CFR 164.304. And you can read here what we've put in the slides when you get them if you like them. And then that brings us, well, if we have a security incident, is that actually a breach? And when we look at the actual breach rules, we do find that, yeah, if you've lost control, you can't access 500 or more records, individual records, that you have a breach or a reportable breach on your hands. Again, you really need to talk this through with your attorneys, obviously well before you get hit, hopefully never, by a ransomware attack, and think through kind of how this works and what it is. But there is some pretty clear language on the HIPAA site, the OCR site, and so something to consider and think through when it comes to this. So let's talk about to pay or not to pay. Payments are rising as you're seeing it. A lot of that's driven by the economy. The attackers are still asking for 10, 15, 20 Bitcoins, but they're getting a lot more money per Bitcoin. Countdown timers, we've talked about, they're becoming commonplace, and now you have this added pressure. You have to be much better and faster at responding because it may cost you more money if you don't respond quickly. Most organizations do pay, including law enforcement. We work with some law enforcement agencies, and they just can't stay locked up. They can't, you know, if a 911 system's down, you can't just leave it down and figure out, like, we're going to, you know, take a stand here. And obviously the ransom payment isn't the only cost. So even if you don't pay for the ransom, you need to think about the loss of revenue. And one of the things that I try to, when I work with boards and senior suite, I think it's on one of these slides, you know, is how long are you willing to hold out? You know, is it a day, 10 days, 3 weeks? What window do you have? One of the things I will tell you, whether you want to pay or not, is conduct a ransomware simulation. Figure out how far ransomware would go. How much would a ransomware attack go in your organization? How far would it get? Because a lot of people don't know, and they think they know, and then you realize, like, you know what, we've got really good controls in place, network segregation, it wouldn't get too far, would be okay, or no, this thing would probably take out everything. So you really, I think, need to know that in order to decide what your vulnerability is and to what level of exposure you have. You do need to decide on the payment strategy now. This is something I would tell you need to take to your senior execs and your board and say to them, what do you guys want to do if this happens? It's happening all over the healthcare industry. What do you want to do? It's happening to major cities. We need to have a conversation on our payment strategy, not after it happens, but now. And hopefully in this presentation, you've got a lot of ammunition that you can use now to explain to them why this is a critical conversation. You need to think about how much you're going to pay. Is there a limit? Is there just something number that's just too much and exceeds the benefit of payment? Hedging is something CFOs do ask us about. Should we buy a bunch of Bitcoin and just have them in case we ever get hit, kind of like we have insurance? And that depends on your economics and your margins, obviously, but given the rise of Bitcoin dollars, it's something you may want to think about. It is part of that conversation, I believe. And how and when would you negotiate? Who's going to be the negotiator? We covered that. We have a post out there that you can read. You can just Google Sensato ransomware, and it's got like some step-by-step instructions on how to pay or not. If you're going to take a stand, again, before you decide either one of these strategies, conduct a simulation and figure out your vulnerability. You need to have air gap backups, even if you're going to pay. And you got to check with your cloud providers, like, are they truly air gapping the backups when you send them up there? Because we've seen too many people say, well, I've got it in the cloud, I'm fine. They get hit, the cloud gets hit, and now they realize, oh, it wasn't really air gapped. So kind of the only real insurance policy you have is to have air gap backups that you can restore from. But remember, that's going to take some time. It's not just, you know, a 2 or 3 minute, 2 or 3 hour kind of restore window if the entire environment got hit. Your failover strategy, I'm going to mention this really briefly. We've seen attacks where automated failover is in place. And trust me, I've been involved in healthcare IT for a long time. I know that, hey, 4 minutes of downtime is too much. 15 minutes downtime is too much. We have to have automated failover. The docs are going to freak out if we don't. In today's world, you need to understand that as these ransomware and other attacks propagate, they're expecting failover, meaning they know you have automated failover. So when the system fails over, the attack just continues. So we really are preaching to our clients right now, really go back and revisit that strategy. And the conversation that needs to take place with the execs and the CMO and CMIO and others in your organization is, you know, is it really truly important to have that 99.999 uptime? Or should we use, you know, or should we have a manual failover that may prevent the attack from spreading? Because if you have kind of a high availability environment or a mirrored environment, chances are if you get hit by ransomware and you can stop it because the automated failover is now manual, you have the ability then to run off of your second tier, your backup tier, right? But if it's automated, that whole backup environment's going to go. And we've seen this. Like, we've seen this in hospitals where the automated failovers occurred, and suddenly the other part of the equation just goes down, and now they're all down. And so if you've ever been wondering, like, well, why is it that the hospitals are down? Don't they have high availability? Yeah, but the attackers know, and high availability helps the attack spread. And then again, how long can you last? How long can you have your cardiac center down? How long can you have your surgical suites down? And it's not just about patient inconvenience. There's real revenue here. And when we conduct discussions with senior suite, I would advise you to do the same as, hey, look, if our ORs were down for 15 days, what's the impact on revenue? Right? Because that's kind of the conversation we have to have at this level, is not really the bits and bytes and scary stuff. It's really, what is the business decisions, and at what point are we going to pay or not pay? So some questions, let me jump to those real quick, and then I'll do some defensive strategies. So if you pay, what are the chances that the decryption will actually work? It typically always works, really does, because the attackers know that if it doesn't, word will get out that, you know what, we paid all this money, it didn't work, you might as well not pay. So they're really great at giving you the decryption keys. So it pretty much always works. How do you know? So how do you know that there won't be vestiges of malware left behind? You know, if it's something like Imhotep, TrickBot, or things like that, or things we know of, then there's a good chance that a forensic review would find that as part of you know, your incident response. If it's 0 day or something really obscure, something like APT21's working on, or North Korea or something, then yeah, it may be left behind. We really push people doing threat hunting exercises, pretending that you've been, you know, it's kind of interesting. What I would tell you, if you have budget set aside for a pen test, one thing you can play with is this concept of doing the pen testing every other year. And on the off years, assuming you're doing them in every year, do a threat hunting exercise. Assume you've been breached, and have somebody come in and kind of go look at, is there any evidence of an actual breach? Go out and actually do a threat hunting exercise, and then hold off on the pen test for another year and just swap them back and forth. Some defensive strategies. I know people hate when I say this, network segregation. This is really no longer a someday project. All the kind of stuff I just reviewed with you, a lot of that relies on the fact that most networks are not segregated. If they are segregated, and really segregated well, chances of the attack spreading are much lower, almost zero. You know, or you're going to contain it to a segment. But it's hard now when you have insurance adjusters coming in and others looking at you after the fact and saying, well, did you know that segregation was a best practice? And you say, well, yeah, but we just, you know, didn't get around to it, or it's too complicated. So you really need to think about that probably in your next 1 to 3 year strategy as to how you can do that. Overinvest in education and testing of your users and your environments. Aggressively patch kind of the stuff we just talked about. All is looking for patch level vulnerabilities that typically can be patched. We talked about threat hunting, talked a lot about incident response being tactical and supportive of that. And this is going to sound self-serving, and it probably is at some level. You really need an advanced SOC. In this day and age, it is hard to stay on top of all this stuff, respond to it. And what I mean by a fourth generation SOC is not just a group that's going to look at alerts and punch a ticket and send it over the wire to you, but really a group that's analyzing what is going on and helping you put defensive and hopefully proactive strategies in place so that you can minimize risk and hold the attackers at bay as much as possible. What else? Okay, I think I have one more slide and that's it. We have started something called the Ransomware Response Center, RRC. What this is, if you get hit by ransomware, you can call us 24/7. We will give you whatever immediate guidance we can. We will also kind of try and do research for decryption keys. And we have some list of decryption keys that are out there. We've got partnerships with DHS and NJCCIC and FDA. So we will try and see if there are decryption keys before you go pay something. So we do this for free. There's no charge for the Ransomware Response Center. I'll give you our phone number in a little bit. But if you need something from that perspective, you get hit, feel free to reach out. You're not going to speak to a salesperson. You're going to speak to our Security Operations Center, and they're not salespeople. So they're not going to try and market to you. They're going to try to help you, and we'll help you as much as we can. We can't do everything for you, but we will do what we can in the initial hours of an attack to see what we can do. We do have an emergency response team. On that, that's a little bit further and deeper than our response center. We kind of do that on an ability to pay. Again, I think at some point, we all got to kind of stand up and go, hey, we got to do the right thing here, and we can't lead with a statement of work. So if you guys get attacked and you really need help, call us. And if you can't pay, you can't pay. And if you can, then please do. But the first thing is, how do we get you stabilized and contained and get things back on their feet? And if you're using other companies, that's great. Or whatever it is, have that idea. We do tactical incident response training. We do tabletop simulation and threat hunting. And we have an awesome security operations center. So just some things to know about us. We don't really call ourselves a SOC. We call ourselves a Security Tactical Operations Center. We are thinking of bringing out this thing called an emergency alerting system. We've had a couple things occur in the past several months where we needed to get the word out. So we're thinking of doing an emergency alerting system where basically you would get a broadcast notification, much like if there's a flood or tornado warning of, hey, we're seeing this threat intelligence, it's developing rapidly. You need to know this. We'll have a threat intelligence briefing at this date and time, but we just trying to find a way we can get the word out to people at a much better pace. Some things coming up. We're going to be in North Carolina on October 2nd. We have a new program we just announced for critical access in rural hospitals. We're going to be doing a webinar on that at the end of October, probably beginning of November. That's a really cool program for us. If you are a critical access rural hospital, please let us know if you can attend this. This is going to be a lot less salesy. We really just want to know, does this program make sense? Even if you're not interested in buying it from us, we just want to know, is this something that critical access and rural hospitals need? And are we structured it correctly? So we would love your help on understanding that. John Walker his contact information is there. If you want the slides, if you have questions we didn't answer, please reach out to him. From an emergency perspective, that's our quote unquote 800 number. If you hit extension 999, that'll put you with our CTOC, our Tactical Operations Center directly. But if you guys have questions, that's kind of everything I had for you. I probably went over. I apologize for that. I hope this was valuable. We really, when we do these, want it to be valuable for you. We try to minimize the sales stuff and really hopefully have you walk away with a checklist of 1 or 2 or 3 things that you can take away. So if you have feedback and you're like, hey, that's the stupidest thing we ever heard, that would be great to know. And if it's valuable, that would also be great to know. So with that, if you have questions, please feel free to put them in the chat window. And I will hang out for a couple minutes and see if there's anything you guys want to clarify, any suggestions or stuff that you may want to contribute to this. That would be great. All right, not seeing anybody typing, so I'm assuming you guys are good to go. Again, thank you so much for your patience and your time. I know you got a lot going on. Hopefully this was helpful, and hopefully we'll be talking sometime in the near future. Thank you.